Good morning to all my students. Welcome you all to Master Nursing classes. So, myself, Mr. Nagraj, working as nursing officer at EMS. And in previous classes, we have discussed the very important basic topics and with MCQs, which all are very necessary for your NORCET examination. And in today's topic, we are discussing the very important topic, which is definitely one question is asking in your NORCET examination. So directly or indirectly, one question will come in your NORCET and other nursing competitive examinations. The topic is related to the neurotransmitters. Okay. Today's topic is related to the neurotransmitter. Very important topic. So which creates base for your psychopharmacology. ನಾವಿಲ್ಲಿ ಇನ್ ಡೀಟೇಲ್ ಆಗಿ ಡಿಸ್ಕಸ್ ಮಾಡೋಣ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ರಿಲೇಟೆಡ್ ಯಾವ್ಯಾವುದು ಇನ್ಹಿಬಿಟರಿ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಗಳಿದಾವೆ ಯಾವ್ಯಾವುದು ಎಕ್ಸೈಟೇಟರಿ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಗಳಿದಾವೆ ಸೊ ಯಾವ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಡೆಫಿಷಿಯನ್ಸಿ ಆದ್ರೆ ಪಾರ್ಕಿನ್ಸನಿಸಮ್ ಆಗುತ್ತೆ ವಿಚ್ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಡೆಫಿಷಿಯನ್ಸಿ ಮೇ ಕಾಸ್ ದ ಅಲ್ಝೈಮರ್ಸ್ ಡಿಸೀಸ್ which neurotransmitters deficiency may causes the myasthenia gravis and which neurotransmitters deficiency may cause the dementia. In detail, very important topic we will discuss today, that is related to the neurotransmitter. Okay, so today's class, that is on the neurotransmitters, which includes the in detail multiple choice questions with the theory. Okay, without wasting the time, we will go for our today's topic. Very important first questions. This is the 5-star question for your NORCET examination. Keep in your mind, very important questions. Read the question carefully till the end and answer the question. Okay. So let me read the question. Which of the following is the neurotransmitter responsible for the inhibiting the pain perception? Very important question for the NORCET. Okay. ಸೊ ಬಾಡಿಲಿ ಯಾವ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ ಇದೆ ಪೇನ್ ಪರ್ಸೆಪ್ಷನ್ ಇನ್ಹಿಬಿಟ್ ಮಾಡಕ್ಕೆ ರೆಸ್ಪಾನ್ಸಿಬಲ್ ಆಗಿರೋದು? ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವಶನ್. ಓಕೆ, yes, option first is the endorphins, option second is acetylcholine, third is gamma aminobutyric acid, fourth is serotonin, fifth is dopamine. ಓಕೆ, ಎಕ್ಸಾಮ್ ಅಲ್ಲಿ ನಿಮ್ಗೆ 4 ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಇರುತ್ತೆ. ಇಲ್ಲಿ ನಾನು ಎಕ್ಸ್ಪ್ಲನೇಟರಿ ಪರ್ಪಸ್ ಆಗಿ ಒಂದು ಎಕ್ಸ್ಟ್ರಾ ನ್ಯೂರೋ ಆಪ್ಷನ್ ಇಟ್ಟಿದ್ದೀನಿ. So no need to confuse here. Okay, just try to answer the question. Yes, very good. So the answer goes here. The option A, endorphins. Okay, ನಮ್ಮ ಬಾಡಿಯಲ್ಲಿ ನ್ಯಾಚುರಲ್ ಆಗಿರೋ neurotransmitter which are responsible for decreasing the pain perception is the endorphins. Keep in your mind, very important question which will come for your last examination. So endorphin ಮೇಲೆ ಇನ್ನು ಬೇರೆ ಯಾವ ರೀತಿ ಕ್ವಶನ್ಸ್ ಕೇಳಬಹುದು? ಸಿ, ಕ್ವಶನ್ಸ್ ಆನ್ ಎಂಡೋರ್ಫಿನ್ ಮೇ ಆಸ್ಕ್ ಲೈಕ್ ದಿಸ್: ವಿಚ್ ಆಫ್ ದ ಫಾಲೋವಿಂಗ್ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಡೆಫಿಷಿಯನ್ಸಿ ಮೇ ಕಾಸಸ್ ದ ಪೇನ್? ಸೊ ಆಪ್ಷನ್ ಅಲ್ಲಿ ನಿಮ್ಗೆ ಯಾವ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಡೆಫಿಷಿಯನ್ಸಿ ಇಂದ ಪೇನ್ ಆಗುತ್ತೆ ಅಂತ ಕೇಳಿದಾಗ ನಿಮ್ಗೆ ಆಪ್ಷನ್ ಅಲ್ಲಿ ಎಂಡೋರ್ಫಿನ್. ಓಕೆ, ಇನ್ ಕೇಸ್ ಆಫ್ ಡೆಫಿಷಿಯನ್ಸಿ ಆಫ್ ದಿ ಎಂಡೋರ್ಫಿನ್ ದೇರ್ ಇಸ್ ಇನ್ಕ್ರೀಸ್ ದ ಪೇನ್. ಸೊ ಎಂಡೋರ್ಫಿನ್, ಅನದರ್ ನೇಮ್ ಆಫ್ ಎಂಡೋರ್ಫಿನ್ ಅಂತಾನೆ ಕೇಳಬಹುದು. ಇದಕ್ಕೆ ನಾವು ನ್ಯಾಚುರಲ್ ಪೇನ್ ಕಿಲ್ಲರ್ ಅಂತಾನೆ ಹೇಳ್ತೀವಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಪಾಯಿಂಟ್. ನ್ಯಾಚುರಲ್ ಪೇನ್ ಕಿಲ್ಲರ್ ಇನ್ ಅವರ್ ಬಾಡಿ ಈಸ್ ಎಂಡೋರ್ಫಿನ್. Okay, so we are having the two very important pain reducing therapies. Among those, TENS and PENS, very important. Transcutaneous electronic nerve stimulation and percutaneous electronic nerve stimulation. TENS and PENS works on, yes, the theory to release the endorphins. Okay, so which increases the amount of the endorphins in the body by stimulating the nerves by transcutaneous and percutaneous electronic stimulation. Okay, so which increases the endorphins in our body. So increased endorphins may lead to decreases the pain perception. So TENS and PENS are works as a pain reducing techniques. Very important. So these 4 questions may ask from your endorphins topics. That is, the responsible neurotransmitters of pain reduction is endorphins. Which neurotransmitter deficiency may increases the risk of the pain? That is endorphins. Which of the following is the neurotransmitters is also called as endorphins? Sorry, which is also called as the natural painkiller? That is endorphins. Okay. Tens and pens works on which principle? That is also your answer goes to endorphins. Very important topics. Okay. So and next acetylcholine, GABA, serotonin, dopamine ಮೇಲೆ in detail ಆಗಿ explain ಮಾಡ್ತೀನಿ next slide ಅಲ್ಲಿ ಇದ್ರ ಮೇಲೆ particular ಆಗಿ questions ಇದೆ. So focus on the topic that is related to endorphins explain ಮಾಡಿದ್ದೀನಿ. ನಾಲ್ಕು ಯಾವ ರೀತಿ ಕ್ವಶನ್ ಕೇಳ್ತಾರೆ ಅದು explain ಮಾಡಿದ್ದೀನಿ. Okay. So next our question comes to very basic question. Which of the following is not a neurotransmitter? ಕೆಳಗಡೆ ಕೊಟ್ಟಿರ್ತಕ್ಕಂಥ ಆಪ್ಷನ್ ಅಲ್ಲಿ ಯಾವುದು ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಇಲ್ಲ. Below given option, which of the following is not a neurotransmitter? Okay. Option A is the epinephrine, B is the non-epinephrine, C is the cortisol, D is the dopamine. Yes, answer me please. Very important questions and very basic question for your NORCET examination. Yes, very good. Read the question carefully. Here they have mentioned the word not. Which of the following is not a neurotransmitter? Is that epinephrine is neurotransmitter? Yes, epinephrine is neurotransmitter. Non-epinephrine is also neurotransmitter, and dopamine is also neurotransmitter. So our cortisol is hormone which is released by our adrenal cortex. So ಇವೆಲ್ಲ adrenal gland ಇಂದಾನೆ ರಿಲೀಸ್ ಆಗ್ತವೆ, ಬಟ್ ಡಿಫರೆಂಟ್ ಟೂ ಪಾರ್ಟ್ಸ್ ಇಂದ ರಿಲೀಸ್ ಆಗ್ತವೆ. ಲೆಟ್ ಮಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಹಿಯರ್. So this is our very beautiful structure of the adrenal gland. Okay. Adrenal gland ಗೆ ಇನ್ನೊಂದು ಹೆಸರು suprarenal gland ಅಂತಾನು ಕರಿತೀವಿ. Adrenal gland is also called as suprarenal gland because it is above the kidney. That is called supra means above, renal means the kidney. Okay. Suprarenal gland also called as adrenal gland. Okay. So which is added with the kidney. So adrenal gland, very important. Here is our two parts of our adrenal gland. Outer one is our adrenal cortex and inner one is our adrenal medulla. Very, very important. So cortex ಇಂದ ಏನೇನು ರಿಲೀಸ್ ಆಗುತ್ತೆ? Cortex ಇಂದ adrenal cortex ಅಲ್ಲಿ further 3 layers ಬರ್ತವೆ. While studying the endocrinology, I will explain in detail all these 3 layers. What is zona, glomerulosa, reticularis? Okay. So we will discuss those topics in detail in the endocrinology. Here is I will explaining the simple base for this topic. Okay. So cortex ಇಂದ ನಮಗೆ so cortisol ರಿಲೀಸ್ ಆಗುತ್ತೆ. Okay. Aldosterone ರಿಲೀಸ್ ಆಗುತ್ತೆ. Okay. And yes, very important, androgens ರಿಲೀಸ್ ಆಗ್ತಾ. Okay. And medulla ಅಲ್ಲಿ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಆಗಿ ಸೆಲ್ಸ್ ಇರ್ತವೆ, ಕ್ರೋಮಾಫಿನ್ ಸೆಲ್ಸ್ ಅಂತ. ಓಕೆ. ಸೊ ಕ್ರೋಮಾಫಿನ್ ಸೆಲ್ಸ್ ಇಂದ ರಿಲೀಸ್ ಆಗ್ತವೆ ನ್ಯೂರೋ ಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್. ಅವು ಎಫಿನೆಫ್ರಿನ್, ನಾರ್ಎಫಿನೆಫ್ರಿನ್ ಅಂಡ್ ಡೋಪಾಮಿನ್. ಓಕೆ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ neurotransmitters. Okay. I hope you have watched my video related to neurotransmitters. ನಿಮಗೆ neurotransmitters ಅಂತ ಬೇಸಿಕ್, ಸೊ neurotransmitters ಅಂತ ಎದಕ್ಕೆ ಕರೀತಾರೆ ಅಂತ ಬೇಸಿಕ್ ನಿಮ್ಗೆ ಗೊತ್ತಿದೆ ಅನ್ಕೋತೀನಿ. ಸೊ ಗೊತ್ತಿಲ್ಲ ಅಂದ್ರೆ ಲೆಟ್ ಮಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಹಿಯರ್. Neurotransmitters is the chemical messengers which are responsible for transferring the information from one nerve to another nerve. Okay. Here is our end of the one nerve, that is called nerve terminals. Okay. Here is the end of the another nerve. This is also called as nerve terminal. See this. Here is our synaptic cleft. So this is the before synaptic cleft. So this is called as presynaptic membrane. What we call this is presynaptic membrane. And here it is after the synaptic cleft. This is called as postsynaptic membrane. Okay. Here is our vesicles. Vesicles ಒಳಗಡೆ neurotransmitters ಇರ್ತವೆ. Okay. Here is the receptors. Okay. When from this way action potential will come, so which acts on the vesicles in the neurotransmitters release ಆಗ್ಬಿಟ್ಟು ಒಂದು ನರ್ವ್ ಟರ್ಮಿನಲ್ಸ್ ಇಂದ ಮತ್ತೊಂದು ನರ್ವ್ ಟರ್ಮಿನಲ್ಸ್ ಗೆ ಇನ್ಫಾರ್ಮೇಶನ್ ನ ಟ್ರಾನ್ಸ್ಫರ್ ಮಾಡ್ತವೆ. ಅವಕ್ಕೆ ಏನ್ ಕರಿತೀವಿ ನಾವು? ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್ ಅಂತ ಕರಿತೀವಿ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ದೋಸ್ ಆರ್ neurotransmitters are responsible for transferring the information from one nerve end to another nerve end. Very important. In also we call the junction between the two nerves. Okay, that is called synapse. Very important. So ನಮಗೆ adrenal medulla ಇಂದ ಎಫಿನೆಫ್ರಿನ್ ನಾರ್ಎಫಿನೆಫ್ರಿನ್ ಡೋಪಮೈನ್ ರಿಲೀಸ್ ಆಗ್ತವೆ ಯಾವ ಸೆಲ್ಸ್ ಇಂದ ಅಂದ್ರೆ ಕ್ರೋಮಾಫಿನ್ ಸೆಲ್ಸ್ ಇಂದ. So we'll discuss that one in later slides. Okay, so which of the following is not a neurotransmitters ಅಂದಾಗ ನಿಮಗೆ ಇಲ್ಲಿ ಈಸಿ ಇತ್ತು ಕ್ವಶನ್, ಎಫಿನೆಫ್ರಿನ್ ನಾನ್ ಎಫಿನೆಫ್ರಿನ್ ಡೋಪಮೈನ್ ಅಂತ ಹಾಕಿದ್ರಿ, ಬಟ್ ಬೇರೆ ಆಪ್ಷನ್ಗಳು ಬಂದ್ರು ನೀವು ಹೇಗೆ ಐಡೆಂಟಿಫೈ ಮಾಡಬೇಕು, ಲೆಟ್ ಮಿ ಎಕ್ಸ್ಪ್ಲೇನ್. ವಿ ಆರ್ ಹ್ಯಾವಿಂಗ್ ದ ಟೂ ಕೈಂಡ್ಸ್ ಆಫ್ ದಿ ನ್ಯೂರೋಟ್ರಾನ್ಸ್ಮಿಟರ್ಸ್, ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ದಟ್ ಇಸ್ ದ inhibitory neurotransmitters and excitatory neurotransmitters. Very important neurotransmitters. These all are inhibitory and excitatory. So inhibitory andre while increasing these neurotransmitters our brain become cool, calm, relax, rest. Okay, those all are called inhibitory neurotransmitters. Excitatory neurotransmitters means if we increase these neurotransmitters our brain become excited, restless, in mania stage. Okay, so those are called excitatory neurotransmitters. Inhibitory neurotransmitters inhibits the brain function, excitatory neurotransmitters increases the brain function. So balance between the inhibitory and excitatory neurotransmitters maintains our mental health. Very importantly, that is our psychology. Okay, very important. So we have to maintain the balance of the inhibitory and excitatory neurotransmitters in order to maintain the mood and all kind of the psychological function. Okay, very important. So our inhibitory neurotransmitters, we are having the 4 inhibitory neurotransmitters and we are having the 4 excitatory neurotransmitters. Okay, first inhibitory neurotransmitter is our endorphin. I have told regarding this. This is also called as the natural painkiller. TENS and PENS works on the endorphins. Okay, so endorphin is responsible for reducing the pain. Decreasing the endorphin may increase the risk of the pain perception. Okay, and we are having the second inhibitory neurotransmitter, that is the gamma aminobutyric acid. So in short we call that is the GABA. Very important neurotransmitters. Okay, GABA ಏನ್ ಮಾಡುತ್ತೆ, GABA ಹೆಚ್ಚಾದ್ರೆ ಬ್ರೈನ್ ಅಲ್ಲಿ ಇನ್ಹಿಬಿಷನ್ ಮಾಡುತ್ತೆ. ಸೊ ಇನ್ಹಿಬಿಷನ್ ಮಾಡಿದಾಗ ನಮಗೆ ಬ್ರೈನ್ ಕೂಲ್, ಕಾಮ್, ರಿಲ್ಯಾಕ್ಸ್ ಆಗಿರುತ್ತೆ, ಕಾಗ್ನಿಟಿವ್ ಎಬಿಲಿಟೀಸ್ ಇನ್ಕ್ರೀಸ್ ಆಗುತ್ತೆ. ಸೊ ಅದರಿಂದ ಎಂಗ್ಸೈಟಿ ಆಗಲ್ಲ. ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್. ಓಕೆ, ಸೊ ಗಾಬಾ ಡೆಫಿಷಿಯನ್ಸಿ ಆದ್ರೆ ಎಂಗ್ಸೈಟಿ ಇನ್ಕ್ರೀಸ್ ಆಗುತ್ತೆ, ಯಾಕಂದ್ರೆ ಗಾಬಾದು ಇನ್ಹಿಬಿಟರಿ ಎಫೆಕ್ಟ್ ಬ್ರೈನ್ ಮೇಲೆ ಇರೋದಿಲ್ಲ. ಸೊ decrease in the effect of inhibitory effect of GABA on the brain, which increases the anxiety. Okay, and our next neurotransmitters comes to dopamine. Very important neurotransmitters. We will study this dopamine while studying the Parkinsonism disease. Very importantly. Okay, this is also an inhibitory neurotransmitter. And serotonin, very important. Serotonin is also called as 5-HT. Okay, so these neurotransmitters are inhibitory neurotransmitters. Okay, and excitatory neurotransmitters means increase in these neurotransmitters excites the brain. Excitement will come in the brain. Okay, so that is the acetylcholine, glutamate, epinephrine and norepinephrine. Very important excitatory neurotransmitters. Those are acetylcholine, glutamate, epinephrine and norepinephrine. Okay, let me go for the next question. Yes, which of the following is a inhibitory neurotransmitter? Answer the question. Just now only we have studied in previous slide related to inhibitory neurotransmitters and excitatory neurotransmitters. So here is the question related to which of the following is inhibitory neurotransmitters. Is that epinephrine is inhibitory neurotransmitters? No, it's an excitatory neurotransmitter. So accept this one. Norepinephrine, this is also an excitatory neurotransmitter. Gamma aminobutyric acid is inhibitory neurotransmitter. Yes, it is an inhibitory neurotransmitter which inhibits the function of the brain. So deficiency of the GABA means decreased inhibition on the brain, means increase the risk of the anxiety. Okay, so we have studied this GABA. GABA is an inhibitory neurotransmitter. Here is our answer comes to GABA. Okay. Glutamate also we have studied in the excitatory neurotransmitters. Let me show this slide. Excitatory neurotransmitters we are having epinephrine, norepinephrine, glutamate, acetylcholine. Okay. In inhibitory we are having endorphins, gamma aminobutyric acid, dopamine, S and serotonin. Okay. So here is the answer for your questions. That is, which of the following is inhibitory neurotransmitters? Means gamma aminobutyric acid is the inhibitory neurotransmitters. Let me explain few more questions on the gamma aminobutyric acid. What is the full form of the GABA? Means gamma aminobutyric acid. Okay. So we will study the some drugs related to the GABA in psychopharmacology. That is, minor tranquilizers or anxiolytics. Anxiolytics are the drugs which are responsible for the decreasing the anxiety. Okay, which are responsible for the anxio means anxiety. Lytics means breaking. So anxiety breaking means decreasing the anxiety. What is anxiety? Anxiety is an uneasiness which is arising from our anticipation of the danger. We are anticipating something dangerous going to happen. We are anticipating something unwanted thing is going to happen. So at that point of the time, something uneasiness is arising from our brain due to the neurochemical imbalance that is called anxiety. Okay, anxiety is an uneasiness arising due to anticipation of the danger that is called anxiety. Okay, so while there is an decrease amount of the GABA, so there is no inhibition on the brain. Okay, if there is no inhibition on the brain means there is no cool calm effect on the brain. So there is no cool calm effect on the brain means we are having the continuous anxiety that is called generalized anxiety disorders. Okay, we are having the panic anxiety disorder, phobic anxiety disorder, and generalized anxiety disorder. So, all these panic anxiety, phobic anxiety, and generalized anxiety disorders will comes in the deficiency of the GABA. Okay, that is a generalized anxiety disorder, panic anxiety disorder. I will explain in detail while studying the psychiatry. Okay, very important. Simple difference is there between these things. Okay, generalized anxiety, panic anxiety, and phobic anxiety. While studying the phobic anxiety, we will study few very important terminology. That is the hydrophobia. Okay, that is fear to the water, and capnophobia. That is fear to the carbon dioxide gases. Various kinds of the phobias will come. So we will discuss that phobias in the psychiatric classes. So I am explaining the purpose of the study of the gamma aminobutyric acid here. Okay, so due to the deficiency of the GABA, so we are having the various kinds of the disorders, that is the gamma aminobutyric acid, panic anxiety disorder, and phobic anxiety disorder. So while treating these things, we are having the drugs which reduces the anxiety, that is called anxiolytics, are also called minor tranquilizers. Okay, minor tranquilizers. So, how these drugs will work, and this is also called as hypnosedatives. So, in these kind of the drugs, we have the first classification and first choice. Those are all called benzodiazepines. Benzodiazepines. Okay, very important. These benzodiazepines is responsible for, yes, these benzodiazepines is responsible for increasing the GABA in the brain. Okay, which increases the GABA. So GABA increases means it's an inhibitory neurotransmitters. Our brain become cool, calm, somewhat sedative also, and a person go into the sleep. So benzodiazepines is also called as hypnosedatives, anxiolytics, and minor tranquilizers. Very important question. How it works? It works on the increasing the inhibitory effect of the GABA. Very, very important question. One question may arise from here. Okay. So we'll go for the next slide. That is very important. Let me read the question. Deficiency of the which of the neurotransmitters lead to anxiety? Just now I have explained the pathophysiology of this all thing. Anxiety is something uneasiness arising out of anticipation of danger. Okay. ಸಮಥಿಂಗ್ ನಾವು ಏನೋ ಒಂದು ಡೇಂಜರ್ ಆಗುತ್ತೆ ಅಂತ ಆಂಟಿಸಿಪೇಟ್ ಮಾಡ್ತಿದೀವಿ, ಅವಾಗ ಏನಾಗ್ತಿದೆ ಅಂದ್ರೆ ಸಮಥಿಂಗ್ ಅನ್ಈಸಿನೆಸ್ ಅರೈಸ್ ಆಗ್ತಿದೆ ನಮ್ಮ ಬ್ರೈನ್ ಅಲ್ಲಿ ಡ್ಯೂ ಟು ದ ನ್ಯೂರೋಕೆಮಿಕಲ್ ಚೇಂಜಸ್. ಅಂದ್ರೆ ಅದಕ್ಕೇನ್ ಕರಿತೀವಿ ಆಂಗ್ಸೈಟಿ ಅಂತ ಕರಿತೀವಿ. ಸೊ ಆಂಗ್ಸೈಟಿಯಲ್ಲಿ ವೇರಿಯಸ್ ಕೈಂಡ್ಸ್ ಆಫ್ ದಿ ಆಂಗ್ಸೈಟಿ ಡಿಸಾರ್ಡರ್ಸ್ ಬರ್ತವೆ. ಜನರಲೈಸ್ಡ್ ಆಂಗ್ಸೈಟಿ ಡಿಸಾರ್ಡರ್ಸ್, ಪ್ಯಾನಿಕ್ ಆಂಗ್ಸೈಟಿ ಡಿಸಾರ್ಡರ್ಸ್, ಫೋಬಿಕ್ ಆಂಗ್ಸೈಟಿ ಡಿಸಾರ್ಡರ್ಸ್. ಇಲ್ಲಿ GABA neurotransmitters deficiency ಆಗ್ಬಿಟ್ಟು inhibitory effect ಕಮ್ ಆಗ್ಬಿಟ್ಟು, so due to decreased inhibitory effect of the GABA we are having that disorders called anxiety. So that disorders occurs due to the deficiency of the gamma aminobutyric acid. Okay. So due to the deficiency of the serotonin we are having the, yes, very important, that is depression. Okay. Due to the deficiency of the dopamine we are having the Parkinsonism. Okay. Due to deficiency of the acetylcholine in the brain or in the central nervous system, so we are having the Alzheimer's disease. Okay. Means and in the neuromuscular junction, so we are having the, yes, myasthenia gravis. Let me discuss in the that particular question. Okay. Here is the question of our studies. Deficiency of the which neurotransmitters lead to anxiety? That is the GABA deficiency which leads to the anxiety. Okay. Yes. Our next question is deficiency of the which neurotransmitters may causes the depression? Depression. We are having this separate topic. We will have a separate class over the depression. Very important topic. So we will discuss while studying the psychiatry. Okay. So here is the class related to neurotransmitters. Just focus on the neurotransmitters. Okay. Deficiency of the which neurotransmitters may causes the depression? Yes. Option A is the serotonin. Option B is the GABA. Option C is the dopamine. Option D is the acetylcholine. So here is the serotonin, when leads to the deficiency of the serotonin, increases the risk of the depression. Okay. And deficiency of the GABA, which leads to the anxiety. Okay. Deficiency of the dopamine, which leads to the Parkinsonism. Okay. Acetylcholine, I explained in previous classes only. So okay, let me move for the next class. Next slide, that is the deficiency of the which neurotransmitters causes the Parkinsonism disease. Okay. So here is our answer, that is the dopamine. Okay. Deficiency of the dopamine which leads to the Parkinson's. You can remember this by your WhatsApp. DP, dopamine deficiency, causes the Parkinsonism disease. We will study that neurostriatal pathway, everything, while studying the Parkinsonism. Okay. And let me go for the next question. So deficiency of the which neurotransmitters may causes the Alzheimer's disease? Okay. So we are having the acetylcholine here. This is also called as S. Acetylcholine is also called as cholinergic neurotransmitter. Okay. So it is responsible for maintaining the parasympathetic nervous system. Okay. For sympathetic nervous system, we are having the epinephrine, norepinephrine, dopamine. Okay. For sympathetic nervous system, those neurochemicals are responsible, and for parasympathetic, acetylcholine is responsible. Okay. So acetylcholine deficiency, okay, inside the central nervous system, which leads to the decreased cognitive abilities, that is our Alzheimer's disease. Okay. Also called as Alzheimer's dementia. What happens in dementia? In dementia, there is impairment in the, yes, memory, personality, and intelligence. And there is totally deficient of the cognitive functions. That is due to the deficiency of the acetylcholine in the central nervous system or else in the brain. Okay. So same thing, if the acetylcholine deficiency occurring in the neuromuscular junction means we are having the very important topic, that is the myasthenia gravis. We will discuss each and every point related to the myasthenia gravis. What is myasthenia crisis? What is cholinergic crisis? Okay, what is ptosis? Each and every point we will discuss while studying that particular disease condition. Okay, keep remember that deficiency of the acetylcholine in the brain or central nervous system which leads to Alzheimer's disease or Alzheimer's dementia. So acetylcholine deficiency in the neuromuscular junction which leads to the myasthenia gravis. Very important question for your NORCET exam. Okay. Here is comes your next question. Deficiency of the which of the neurotransmitter causes the myasthenia gravis? Just now I explained regarding this. So deficiency of the acetylcholine in the our neuromuscular junction. Okay, where our nerve and muscles are joining, that is called as neuromuscular junction. Here is our acetylcholine releases from our nerve vesicles. Okay, here is the receptors present. So neuromuscular, here this is totally we call the neuromuscular junction. Myasthenia gravis is autoimmune disease also. So here is some autoantibodies may destroy these receptors. Okay, so due to this also myasthenia gravis occurs, and some very importantly deficiency of the acetylcholine in the neuromuscular junction leads to the myasthenia gravis. Okay, so let me go for the next slide. Adrenal gland cell which is responsible for release the neurotransmitters. Okay, while studying the first question only I have explained regarding this. So which of the following the adrenal gland cells which are responsible for the releasing the neurotransmitters? That is called chromaffin cells. So okay, uncontrolled growth of the chromaffin cells leads to which cancer? Yes, that is our pheochromocytoma. Pheochromocytoma. Okay, very important cancer condition where is increasing our norepinephrine, epinephrine, dopamine, which leads to the patient is in always sympathetic condition. Okay, sympathetic nervous system always activated. Very important topic. Okay, so while studying the endocrinology, will study the particular thing related to pheochromocytoma. Okay, here is the answer comes to the chromaffin cells are the cells which are responsible for the releasing the neurotransmitters from the our adrenal gland. Okay, so which all are the neurotransmitters releases from the chromaffin cells? That is our norepinephrine, epinephrine, and dopamine. Okay, so PEG cells. PEG cells is present in the our fallopian tube. So here is comes our 10 to 12 centimeter fallopian tube. Okay, here is our ciliated columnar epithelium is there. In between the ciliated columnar epithelium, there is cells which are responsible for providing the nutrition for the zygote and the inner environment of the fallopian tube. That is the PEG cells. So my direct question comes from your PEG cells, where location of the PEG cells is our fallopian tube. Okay, and megakaryocyte. What is the megakaryocyte? Megakaryocyte is the precursor of the platelet. Okay, immature form of the platelet is called, or precursor of the platelet is called megakaryocyte. Okay, what is our pneumocyte? Pneumocyte is the type 1 alveolar cells which are responsible for the gas exchange in our lungs. Okay, so here is the important class of today. So in today's class we have discussed the various neurotransmitters in detail. So and the diseases conditions which comes due to the deficiency of that particular neurotransmitter. Hope this video is very much helpful for your study. So keep watching the videos till the end. Okay, thanks for watching this video. We will meet in next class. Okay, thank you.